Hello, and welcome to our channel. Today, we're tackling a crucial topic: 8 warning signs of cancer you should not ignore. This is a subject that touches us all, whether directly or indirectly, and staying informed is key. Cancer is a formidable adversary that can strike unexpectedly. Whether it's affecting you, a loved one, or a friend, knowing the warning signs can be your first line of defense. Remember, cancer doesn't discriminate, and catching it early can make all the difference. In today's video, we're going to break down 8 critical warning signs that could indicate cancer. These symptoms often go unnoticed or are brushed off as something minor. By learning to recognize these signs, you could potentially save a life, perhaps even your own. So what are these warning signs, and how can you differentiate them from everyday ailments? Stay with us, and we'll guide you through the essentials. Let's dive in and get started. 1. Unexplained weight loss. Unexplained weight loss can be quite alarming and may indicate a serious health issue, including cancer. This happens when you lose a noticeable amount of weight without changing your diet or exercise habits. It's usually significant if you drop more than 5% of your body weight within 6 to 12 months without a clear reason. When it comes to cancer, this weight loss occurs because cancer cells grow and divide rapidly, using up a lot of the body's energy. This increased metabolic activity can make you lose weight as your body tries to keep up with the energy demands. Cancers like pancreatic, stomach, lung, and esophageal are especially known for causing significant weight loss, often before other symptoms show up. However, it's important to remember that unexplained weight loss doesn't always mean cancer. 2. Fatigue. Fatigue is more than just feeling tired after a long day. It's a deep, pervasive exhaustion that can be a sign of a serious underlying health issue, including cancer. This kind of fatigue isn't just about needing a good night's sleep. It's a relentless sense of tiredness or lack of energy that doesn't go away, no matter how much rest you get. Cancer-related fatigue is complex. One reason it happens is because the body is constantly fighting the cancer. The immune system works overtime, and the energy demands of rapidly growing cancer cells can drain the body's resources, leaving you feeling weak and exhausted. Certain cancers, like leukemia, are particularly known for causing severe, ongoing fatigue. When cancer spreads to other parts of the body or affects vital organs, it can make fatigue even worse. It's important to remember that fatigue isn't only caused by cancer. Chronic illnesses, some medications, poor sleep quality, stress, and nutritional deficiencies can all lead to persistent fatigue. Because fatigue can significantly impact your daily life, it's essential to seek medical advice if you're experiencing this symptom. 3. Changes in skin. Changes in your skin's appearance can be a warning sign of underlying health issues, including cancer. This includes the appearance of new moles or changes in existing ones, such as alterations in color, size, shape, or texture. One of the most serious concerns with skin changes is their potential link to skin cancer. Skin cancers like melanoma, basal cell carcinoma, and squamous cell carcinoma often show up as noticeable changes in the skin. These can range from shifts in pigmentation to irregularities in the border or texture of a mole. Early detection is crucial for skin cancer. Spotting and treating skin changes early can lead to much better outcomes. 4. Persistent cough or hoarseness. A persistent cough or hoarseness can be a warning sign of a serious health issue, including the possibility of cancer. If you have a cough that lasts for weeks or even months without getting better, or if your voice becomes noticeably rough or raspy, it's something you should pay attention to. While a long-lasting cough or hoarseness can indicate lung cancer, these symptoms can also be associated with other types of cancer. For instance, cancers of the throat, larynx, or esophagus can lead to persistent hoarseness. Similarly, cancers in the lung or nearby areas can cause a chronic cough. However, it's important to remember that not all persistent coughs or hoarseness are due to cancer. Respiratory infections, allergies, or irritants like smoking can also cause these symptoms. 5. Changes in bowel or bladder habits. Changes in bowel or bladder habits can be an early warning sign of an underlying health issue, including cancer. If you notice any deviations from your regular patterns of bowel movements or urination, it's important to pay attention. When it comes to bowel habits, watch out for persistent constipation or diarrhea. Constipation involves infrequent or difficult bowel movements, while diarrhea is characterized by frequent loose stools. Another red flag is the presence of blood in your stool, whether it's visible or detected through tests. These changes can point to gastrointestinal problems, including colorectal cancer. For bladder habits, be aware of changes in how often you need to urinate. If you find yourself going to the bathroom more or less frequently than usual, take note. 6. Difficulty swallowing. Difficulty swallowing, or dysphagia, is a worrying symptom that could point to a serious underlying issue, including cancer. This symptom is characterized by a noticeable and ongoing challenge or discomfort when trying to swallow food or liquids. While difficulty swallowing can be a sign of throat or esophageal cancer, it's not limited to these types. Other cancers, particularly those in nearby areas or those that press on the esophagus, can also cause this problem. There are several potential causes of difficulty swallowing. In cancer cases, a tumor might narrow or block the esophagus, making it hard for food and liquids to pass. Additionally, the inflammation or irritation caused by the cancer can contribute to the discomfort. 7. Abdominal pain or discomfort. Abdominal pain or discomfort, which is felt in the area between the chest and pelvis, is a symptom that can be associated with various types of cancer. Recognizing it early is crucial for effective treatment. One cancer commonly linked with abdominal pain is ovarian cancer. This type of cancer might cause persistent, vague discomfort or pain in the lower abdomen, often accompanied by bloating. The pain can vary in intensity and might be either sporadic or constant, typically felt deep within the pelvis. Another type of cancer associated with abdominal pain is pancreatic cancer. The pain from pancreatic cancer is often described as a deep, gnawing discomfort that may radiate to the back. 8. Unusual swelling or lump. Unusual swelling or lumps refer to abnormal enlargements or masses in parts of the body where they aren't typically found. These can be significant indicators of underlying health issues, including cancer. They might vary in size, texture, and location depending on the type and stage of cancer. Sometimes, these lumps are painless, while other times they may be uncomfortable. They might also be visible on the skin surface or hidden beneath it. In cancer cases, these lumps or swellings are usually caused by the growth of abnormal cells that form a mass or tumor. Tumors can be benign, non-cancerous, or malignant cancerous. Malignant tumors can potentially spread to nearby tissues or even other parts of the body through a process known as metastasis. However, not all unusual lumps are cancerous. They can also be caused by non-cancerous conditions like cysts, lipomas, or infections. These benign growths can still lead to noticeable bumps or enlargements. Should you find these insights beneficial, I invite you to express your endorsement by engaging with this content, liking it, subscribing to my channel, and activating notifications for a steady stream of the latest health and nutrition wisdom. Your support fuels the dissemination of valuable knowledge.